Thanks for joining us for our WTVA 9 News Coronavirus Town Hall. I'm Craig Ford, joined by Baptist Memorial Hospital Union County Dr. H.F. Mason. Quickly, we're going to go through some of these other viewer questions. Okay. Our next one, what are the effects of the coronavirus on pregnant women? Or do we know?
At this point, I don't think we know for sure. As to my knowledge, I don't think that there are any harmful effects that we know of. Mm-hmm. I'll leave it at that because I'm just not sure.
And I think people may not be aware, but because this is so new, mm-hmm. there's some research, but really not a lot of research.
That's true.
Is there?
That's true. We're learning. We're learning more and more every day, but there's still a whole lot that we don't know.
Another question for you. What do healthcare professionals need to wear to protect themselves from the virus? So I'll ask you, what if somebody comes in at Baptist?
Well, we have protocols at our hospital, and we've been working on these protocols for a couple of months. If somebody comes in with any type of ILI, influenza-like illness, I'm sure you've heard that, cough, fever, body aches, we are immediately putting a mask on them, and then we're asking them further questions based on the CDC. You know, are you having those symptoms? Have you traveled to these areas? Have you been around anybody who has had COVID-19? If that is the case, then we have protocols where we are putting on what we call PPE, personal protective equipment. That would include a mask, an N95 mask, which is a special mask that helps prevent the virus particles from entering, from penetrating the mask, eye protection, gowns, and gloves. And then we are immediately taking those patients to one of our isolation rooms in the emergency department. It's a negative pressure room, and by negative pressure we mean that when you open the door, everything gets sucked into the room as opposed to positive pressure getting blown out.
I know there's been a lot of debate about masks. You just mentioned about wearing masks. I'm assuming your position would be like everything else we've heard is it's not really going to help anybody.
No. I don't think wearing a mask out in public is going to help you. Obviously, if you are around a high-risk person, if you're taking care of a high-risk person, yes, a mask is going to. I say a high-risk person, a person who is infected. Yes, a mask will help you.
All right, here's one that I got hit with. So I go to the gas station. I want to fill up my car. Do I need to wear a glove when I pick up the pump? Do I need to have some sort of covering on my hand when I pick up the pump? Or should I just grab it, fill it up, clean my hand? What?
That's a good question. And I think that answer is going to be different for every person. Some people are going to have much more comfort if they're wearing gloves. I think that I would, personally, once I've filled my car up, I do carry a little hand sanitizer liquid bottle with me. I do clean my hands and get back in my car.
And that was what I was going to hit you up with. One of the things I definitely wanted to ask you is, when all this is going on, what are you doing? What's your family doing to deal with all this?
Well, I have 2 children at home right now who are not at school. I have 2 children in college, and we're just telling them, don't panic, be smart. Use just like the CDC guidelines. Use proper hand hygiene. Don't be around sick people. If you're sick yourself, be smart. We're hearing a lot about social distancing now. As you notice, we're 6 feet apart here, which is good. But I think that it's not going to hurt us to not go out and be with our friends. It's not going to hurt us for just a short time to pay attention and listen to what the experts are telling us. And I know it's going to be painful for a while, and it's totally disrupting our way of life, but this is something that we have to do. And I do think that we need to be serious about it.
More right after this.